Hello, my name is Morgan Smith. I am in the HIM 2012 with Professor Travick at Santa Fe College. This presentation is going to be about electronic health records and personal health records. During this presentation, I will explain what is an electronic health record and personal health record and what purposes they serve. I will also explain who owns the records as well as who can access the record and who can make changes. Finally, I will state some reasons why I think both of these types of records are beneficial. The electronic health record is an electronic version of the patient's medical records. These records contain things such as patient demographics, past medical history, progress notes, lab and radiology reports, and other things of that nature. Many facilities are moving away from the large paper charts that most of us are used to seeing in doctor's offices to this electronic version. An electronic health record is owned and maintained by the provider that created it. This means that if an amendment must be made, the provider must make an addendum, and each facility has its own rules governing the amendment of a record. Now, even though the provider owns and maintains the electronic health record, that does not mean that they are the only ones that can access it. With the help of the electronic health record software, or EHR software, and the Health Information Exchange, authorized providers across multiple facilities can gain access to the patient's electronic records. On this screen, we see an example of an electronic health record. This particular image is an image of Epic, which is the EHR software that is used by UF Health Shands Hospital. And on the far left, we can see the different pieces of the record that can be added by the doctors or nurses in the facility. Some of these pieces are demographics, allergies, history, forms, and other things. Next to that, we see a pop-up of the charting screen where a provider is tracking exercise vitals. There, they can also add progress notes, any orders they wish to do, and any follow-up instructions that they may have for the patient. Benefits of the electronic health record. Other than the obvious reduction of paper and saving of trees, there are a few reasons that I feel electronic health records are very beneficial. First, as I stated, these records can be shared across multiple facilities, which is very helpful in emergency situations, or really any situation that would require you to be seen by a doctor other than your normal doctor. Next, the information is always available and always up to date, with a few exceptions, of course. Now let's just say you have to have surgery. With the old paper records, the surgeon would have to physically have your chart. Therefore, after the surgery, they can do their operative report. Now, let's just say after your surgery, the surgeon gets called into another emergency surgery. They won't have time to do your operative report right away. Therefore, they will have to hold on to the chart until they are done, and then they can document your operative report. Now, because they have the chart in their possession, the nurses on the floor taking care of you will not be able to make any notes about your progress in recovery. They won't be able to document any medications that they've been giving you. Therefore, the information will be behind from there on out. Now, with electronic health records, even if the surgeon gets called in to another surgery, the nurses can still go in, make their notes without any issues. And then the doctor can just do their operative report whenever they are done with their emergency surgery. The personal health record is an electronic application that the patient can use to view their own health record. However, the personal health record only contains a subset of the electronic health record, such as demographics, medications, and allergies. The personal health record is owned and managed and amended by the patient themselves. This is why the personal health record does not contain the complete electronic health record, as patients should be allowed to update their over-the-counter medications and their allergies, but not update their diagnosis or any of their operative reports. Here is an example of an electronic personal health record. As you can see, the record can be viewed on either a computer or a mobile device. And you can see that the patient can track their blood pressure, their diet, any measurements that they have, such as their waist measurements or their weight, and they can view any test results, such as their pap smear. Benefits of the personal health record. It is, in my opinion, that the personal health record is one of the most beneficial pieces of the health record, especially to the younger generations, such as the millennials, who always have a phone in their hand. It allows the patients to become more engaged with their healthcare and more involved. And in my opinion, the more involved I am with healthcare, the more I actually care about it. Adding and updating information in the personal health record is easier than calling the office or making an appointment. I can just add my new over-the-counter medication right on my phone as soon as I get it. Simple and easy. As opposed to speaking to someone in the office, waiting on hold, waiting to make an appointment. Do we really know that those nurses actually put our notes in our chart when we call? Who knows? This, in turn, allows the facilities to have more information because I added it at home. I didn't wait until my appointment and most likely forgot when I got there because I was so ready to get out of there. The more information that is gathered outside of the office means the less that must be obtained during the appointment. No one wants to spend an hour at the doctor's office. So therefore, the less information that's gathered in the office, the less time we have to spend there, which is both good for patients and providers alike. In closing, the electronic health record and the personal health record are both great technological advances that have been made in the healthcare industry. And at one point or another, they will affect everyone that is involved in healthcare. The electronic healthcare can be used in a variety of settings: hospital, doctor's office, long-term care, or even insurance call centers. The personal health record is primarily for patient use, but the doctor can view it as well, which makes it a great tool for patients to communicate with their doctors outside of office hours. Both the electronic health record and the personal health record allow for greater continuity of care, which is the most important part for both providers and patients. The best care can be received when everybody has all of the information. These are my references. Feel free to visit any of them and learn more about the electronic health record and the personal health record. Thank you for watching. I hope you enjoyed it.